Let's begin with our opening remarks this afternoon, and we'll start with Deputy Mayor Josh Morgan.
Well, thank you, Dan, and good afternoon. It's an important day for many across the region as we continue to emerge from quite possibly the worst period of this pandemic. As of this morning, restaurants, gyms, and movie theaters can return to full capacity. Large venues like Budweiser Gardens are back to 50% capacity. And of course, those facilities are scheduled to be at full capacity by March 1st. Even more encouraging, however, is the continued decline in hospitalizations and ICU admissions, both locally and provincially. Across Ontario, those numbers have dropped to their lowest levels since the first week of January. Here in London, the number of COVID patients at LHSC has dropped 31% from this day last week and 57% from this day last month. These are obviously excellent trends and ones we hope to continue to see in the coming days and weeks. Despite the reopenings, however, I also want to take a moment to remind everyone to be careful if they're out and about today and tomorrow. We are under a winter storm warning with freezing rain expected this afternoon, changing to some pretty steady snowfall overnight. Obviously, if you're out driving or walking somewhere, take your time, watch for ice, and watch out for others. I know the City of London's winter maintenance team is ready to go, and they're closely monitoring the system as it develops. So I just wanted to remind everybody to be cautious in the meantime, and hopefully getting around to a much easier out and about tomorrow and through the weekend. That's all I had for today, so I'll turn it over to Dr. Summers.
Thank you so much, Deputy Mayor Morgan. Good afternoon, everyone, and thank you for joining us today. Indeed, a winter storm is upon us, and safe travels to all. Be careful as you walk the streets or drive the streets. The Middlesex-London Health Unit is reporting 91 new COVID cases today, 0 new deaths. With the announcement of the reopening stages continuing, we want to remind folks that although capacity limits are being lifted in some settings where proof of vaccination is required, there are still public health protections remaining in place. Those places that require proof of vaccination, including restaurants, cinemas, etc., are open to 100% capacity. However, proof of vaccination continues to be required for those 12 years of age and older. For venues such as Budweiser Gardens or other large sporting events, 50% capacity is in place and proof of vaccination is required. March 1st, we'll see further reopening of capacity limits and the removal of the proof of vaccination. But as a reminder, proof of vaccination remains in place at all settings where it has been required to date up until March 1st. Even as the public health protections are scaled back, it is critical for people to remember that the prevalence of COVID-19 in our community remains very high. If not for the protection that the vaccine has provided us, notably against severe outcomes, hospitalizations, and death, we would still be in the depths of significant restrictions in order to adequately protect ourselves, our communities, and our healthcare system from significant death and significant hospital admissions. Over the next number of weeks and through the spring, I want to emphasize the importance of ongoing masking in indoor environments, of continuing to limit your close contacts, to limit your risk for potential exposure to COVID-19, and most notably, to get vaccinated. We have had over 90% of those 12 and older in our community be vaccinated for 2 doses. However, we have a significantly less number of people who've received that booster dose. And the booster in the face of Omicron is the significant protection against not only contracting COVID-19, but of ending up in hospital. For individuals, particularly those over the age of 50, if you've not yet received a booster, please go as soon as possible. As we reopen, your risk of exposure gets higher and higher. And so take advantage of the ease in which you can get boosted right now. Visit any of our mass vaccination clinics, make an appointment online at covidvaccinelm.ca, or of course, just walk in. You can also visit any pharmacy that offers the vaccine in order to be appropriately boosted. The importance of getting boosted is not just for those over 50, though. It's for everyone of all ages, and starting tomorrow, it is for those 12 to 17 years of age, 6 months after they have received their second dose. For individuals who are 12 to 17 years of age, you can start booking an appointment at covidvaccinelm.ca starting tomorrow at 8 a.m. And I strongly encourage you to do so. We saw tremendous uptake of vaccination amongst 12 to 17-year-olds, and we're delighted that boosters will now be available to that group starting tomorrow. We're also seeing a slowing in vaccine uptake amongst 5 to 11-year-olds. Nearly 60% have received at least one dose, and the number of people who've received 2 doses in that age group is rapidly rising. However, we still got a ways to go. And I want to emphasize for parents and guardians that it is critical that you protect your young ones against COVID-19. Although the risk of ending up in hospital is low, it is still there, and it is substantially safer to be vaccinated against COVID-19 than it is to get COVID-19. The evidence around the protection gained from the vaccine for 5 to 11-year-olds has strengthened, and the evidence that the risks are very, very low has also strengthened as well. It is a strong recommendation that those 5 to 11 get vaccinated. In order to promote vaccination, we at the Middlesex-London Health Unit have released a number of new initiatives to increase vaccination in this group. Just this past lunch hour, we had an Instagram Live with Dr. Michelle Barton-Forbes from London Health Sciences Centre answering questions about the vaccine. This coming Monday is Superhero Day at all of our vaccination clinics, including our mobile clinics, where our favorite superheroes will be present to help encourage our youngest superheroes to get their vaccine. If you're a parent and guardian, take advantage of that day to come on out, meet those superheroes, and get vaccinated. We're also out in schools providing community hub clinics based in schools in the late afternoon and early evening. This past week, we've been in 10 schools. Next week, that continues as we try to make the vaccine more readily available to those who may have difficulties accessing our mass vaccination clinics. For parents and guardians, I know that there may be some worries about vaccinating your kids. There may be questions about how experimental this vaccine or how early on in the vaccination program we are. I want to encourage you to be confident in the security and the safety provided by this vaccine. This vaccine for 5 to 11-year-olds was well studied. It continues to be monitored for any adverse events following immunization. And as we continue to see tens to hundreds to millions of doses of vaccine rolled out across the world, the safety of the COVID mRNA vaccines becomes strengthened. These are very reliable, very safe vaccines that prevent your child from getting COVID-19. So please come out and join us on Monday at Superhero Day. Or if you can't wait that long, come out this weekend. We'd be glad to see you and celebrate you getting your child vaccinated, protecting them, your family, and our community against COVID-19. We'll continue to watch those numbers here at the health unit. Our hope is that additional public health protections will not be required. However, as always, we do have to adjust things week by week, but we'll take the wins where we can. And as we see our reopening today, we'll celebrate that. With that, back to you, Dan. Thanks so much. I look forward to the questions.
Thank you very much, Dr. Summers, and thank you, Deputy Mayor Morgan. We do have some questions in the queue, and again, a reminder for the media who are in attendance this afternoon, all you need to do to submit your questions for Dr. Alex Summers or Deputy Mayor Josh Morgan is to click on the question mark inside the text bubble here on Microsoft Teams. And when you do, if you could indicate your name as well as your media outlet and who your question is for. Let's go to the questions right away. And the first question this afternoon is for Dr. Summers, and it's from Jennifer Beeman at the London Free Press. Dr. Summers, we're coming up on 3 months since the 5 to 11-year-olds became eligible. Is vaccine uptake in the age group as high as you'd hoped?
Thanks for that question, Jen. Those that know me, and as you get to know me, you will find that I am a very optimistic person and a very hopeful person. So when we launched the vaccination campaign for 5 to 11-year-olds, my hopes, as with all things, were high. And when it comes to vaccination coverage, I hope for vaccination coverage that exceeds 90% or more, because I know and can see through the evidence the protection that these vaccines provide. We're at 60% for first dose coverage. We want to be higher. And that's why we are continuing to emphasize the importance of vaccination in 5 to 11-year-olds, particularly with kids back in school, particularly as sporting activities and recreational and social activities begin to increase in frequency. We hope to see it rise. That's why we're continuing to, again, get out there, celebrate where we can, people getting their vaccine. But we do hope to get higher than that 60% over the next little while.
Thank you very much, Dr. Summers. We do have a couple of follow-up questions from Jen Beeman. Dr. Summers, Jennifer asks, are you more concerned about unvaccinated children as the province loosens pandemic restrictions, such as capacity limits and vaccine passports?
Thanks, Jen. Certainly, I am always concerned about things that increase the risk for COVID-19 transmission and subsequently the risk for poor outcomes from COVID-19. As we reopen, individuals that are unvaccinated, as I've said before, in the face of Omicron, it is not a question of if they will be exposed and develop symptoms from COVID-19. It's a matter of when. Omicron is so infectious that unvaccinated individuals will, if they are engaging in any amount of social activity or interaction with any other individuals, are going to get COVID-19 at some point. So for any unvaccinated individual, including unvaccinated children, as we see public health protections scaled back, the risk for exposure and the probability of exposure in the next short while goes up significant. And I, of course, worry about anybody who doesn't have the single best protection they can have, which is a vaccination status that is completed. So I, again, would emphasize how critical it is for 5 to 11-year-olds to get their primary series and for anybody over the age of 12 starting tomorrow to get boosted.
Thank you very much. And we do have a couple of more questions from Jennifer Beeman. Dr. Summers, the health unit is doing all kinds of things to promote children's vaccination, and you mentioned a few in your opening remarks. But how much does uptake in the 5 to 11-year-old age group just depend on parents slowly becoming more comfortable with the shots?
Thanks, Jen. We know that the steps and components that need to be in place for a parent to vaccinate their child are many. This is a multifocal initiative that we need to undertake in order to increase vaccine uptake. We need to make sure the vaccine is readily available. We need to make sure that people are confident in the vaccine, both the safety and the benefits of getting vaccinated. And there is a comfort level that needs to grow. Every time a child gets vaccinated, there's an increasing likelihood that somebody else is going to become more confident in that vaccine through hearing the good experience from family and friends, that the vaccine is in fact a good thing and not something to be afraid of. I think it is going to take an increasing amount of time for us to vaccinate people who've not yet been vaccinated or vaccinated their child. Everybody's got a reason for their delay. We know that. And that's why we want to talk about the benefits. We want to talk transparently about the risks. We want to talk transparently about the risks of not getting vaccinated. I think it is going to take time. I think there will be some folks for whom, no matter what type of evidence they're presented with, vaccination won't happen. But there are some for whom they just need a little bit more information, and that's what we're trying to provide. I know Deputy Mayor Morgan has some thoughts on this as well. Over to you, Deputy Mayor.
Yeah, maybe just on the heels of what you said about parents and how confident they feel. I have two children in the 5 to 11 age group, and I'm happy to share, my wife's and my personal experience about our decision to get them both vaccinated, of which they both now had 2 shots. I would say we followed the path much like Dr. Summers described. We did our research. We had our own experience with the vaccinations that we got ourselves. And of course, we had access to our primary healthcare doctor, our family doctor, and we had a conversation with her about the vaccines, particularly for the age groups, understand the risks and benefits, and then made the decision. I know there are many people who don't take that decision lightly, and I don't think anybody should, but we do have excellent primary care physicians in the City of London, and for those who have access to one, it may be as simple as having a conversation with your family doctor about vaccinating your children and getting the answers to the questions you have. So my wife and I followed a process. Our children are now have gotten both of their shots in that age group, and we're very comfortable with the decision we made.
Thank you very much, Deputy Mayor Morgan and Dr. Summers, for those answers. And certainly that is the kind of information we're hearing that parents are looking for, that experience of other parents and other families, and certainly, as you mentioned, the voice of a trusted professional like your healthcare provider. Let's move on to another question. This one again is from Jennifer Beeman. Dr. Summers, children have a lower risk of severe complications from COVID-19. Has the sheer volume of Omicron cases made it so more children have required hospital care in this wave?
Thanks for that question, Jen. Given the transmissibility of Omicron, I have no doubt that we've seen a higher number of child cases during this Omicron wave. And as a result, a small percentage of them will have some of the more severe outcomes. Those that are vaccinated, of course, are more protected against severe illness. In our local children's hospital, there was influx in COVID cases over the last week, as well as kids admitted not for COVID, but with COVID. They were admitted for other things, but on admission tested positive for COVID. That has subsequently declined slightly. So we'll continue to monitor. On the whole, children continue to do generally well. But as I've mentioned, given how prevalent COVID is, we start to see the rarer outcomes of severe illnesses associated with COVID, which do require hospitalization. We also need to acknowledge some of the long-term impacts of getting COVID-19, including a multi-inflammatory syndrome in children, which is an inflammatory response that follows somebody getting COVID-19, and it's particularly notable in children. So there are other risks that we are worried about with the high prevalence of COVID-19 in the community, particularly for those that are unvaccinated. Again, it's a challenging scenario we find ourselves in. It is critical, for example, that kids are in school and that childcare centers are open. And the risk of being in school there is a risk of getting COVID-19 from being in school. However, there's also a risk from not being in school, and there's a risk of COVID-19 from not being in school from other encounters out in the community. So we continue to emphasize that kids need to be in school, and we also need to do what we can to protect kids from COVID-19, and vaccination is chief amongst it, in addition to masking and staying at home if you're ill, of course. Thanks, Dan.
Thank you, Dr. Summers, and thank you, Jen, for those questions. Let's go to our next question, and this one is from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Summers, what impact will Health Canada's approval of Novavax have on the MLHU?
Thanks for that question, Jacqueline. Yes, Health Canada did approve Novavax this past week. The National Advisory Committee on Immunization still strongly recommends an mRNA vaccine as a preference to a vaccine like Novavax, which means Pfizer and Moderna are preferred over Novavax. And Novavax is really only for those who are not willing to take an mRNA vaccine for whatever reason. We don't know the distribution plan for Novavax through Canada, so we'll be learning more about that over the next few weeks. I anticipate in time we will get a small amount here in our region, similar to how we got a small amount of the Johnson & Johnson vaccine, and we will have a very bespoke way to provide that vaccine to people who are unwilling to get an mRNA vaccine.
Thank you very much. And just a reminder for the media who are in attendance this afternoon, if you've been waiting to ask a question, now would be your time to get that question in, as we are getting down to the end of the questions that we have in the queue. Let's go to our next question. Dr. Summers, this one is for you again, and it's from Sophia Rodriguez at CBC London. Dr. Summers, with the lifting of restrictions and better numbers, would you say the worst of the pandemic is behind us? And how would you describe this time?
Hi, Sophia. Thanks for that question. We always look on the bright side, and we hope that we are seeing a decline that will be sustained through the summer, through the spring into the summer. However, as public health protections are rolled back, the risk of transmission increases. What we don't necessarily know is how many people remain vulnerable to COVID in our community. We know how many people have been boosted, but we don't know in totality the number of people who got COVID-19 in the last Omicron wave, and as a result are protected at least for the next month or two. So we don't yet know exactly what the trajectory will be through the remainder of February and into March, given the scaling back of those public health protections. This could go a few different directions. We may see an ongoing decline and no further increases in hospitalizations. We could see increase in case counts, but no ongoing climb in hospitalizations because the cases are predominantly amongst younger people who don't have a booster. Or we could see what we don't want to see, which is a return in hospitalizations climbing. We always have to be on the lookout, of course, for additional variants as well. This pandemic and this this SARS-CoV-2 virus continues to throw us curveballs, taking us back, for example, to October, November, where we were very confident that we had dealt with the Delta strain, right? The vaccine, 2 doses, was very, very impactful against preventing transmission of the COVID Delta variant. However, we always knew the possibility of a variant for which the vaccine was not effective and that might be more transmissible was there, and that's what arrived in the form of Omicron. So we never know what's around the corner that way. What we do know is that we have to continue to be diligent in surveillance of monitoring for COVID-19 activity in our community, and particularly during these colder seasons, we have to mask indoors at a minimum and take full advantage to get ourselves protected with the vaccines that are available to us. And that's, again, not to sound like a broken record, why I really want to emphasize the importance of getting boosted if you've not yet done so.
Thank you very much, Dr. Summers. We've got a couple more questions. Let's go to a question from Sonia Persad from Western Gazette. Dr. Summers, with many restrictions lifting, including the Section 22 order that had been in place in London, is the MLHU working with Western University to lift restrictions on dining and other capacity limits? What do you anticipate that this will look like?
Thanks for your question, Sonia. We continue to work closely with other institutions in our region, including Western, around the measures that they utilize on their campus. Western and all other post-secondary institutions in the province need to comply with the provincial requirements, which Western always has. And there are also opportunities for individual organizations, campuses, businesses to do other things to limit transmission in their settings. So when it comes to dining and other capacity limits, at a minimum, Western has to comply with the provincial requirements, which at the moment will be opening up, particularly if proof of vaccination is required. And over time, we will likely see that translated onto campus as well. However, we always know that there are ways in which additional protections can be in place, and we continue to work with Western to try and find the best way forward. They've been tremendous partners through all of this, and we're really delighted to continue to work closely with them.
Thank you very much, Dr. Summers. Let's go to a question from Christy Lee Varley at CTV London. And Dr. Summers, I'm thinking this is a question for you. Christy Lee asks, can you please explain the inflammatory reaction for kids? Is it post-diagnosis? What should parents look for?
Thanks, Christy Lee. Yeah, multi-inflammatory syndrome in children following COVID-19 is not significantly common, but it can happen. And what it looks like is an inflammatory reaction following the acute illness of COVID-19. And it can be the result, it can manifest in persistent fevers associated with other inflammatory markers like diarrhea or stomach pain or other aches and pains. It's really the persistent fevers that would be the starting reason to consider something like multi-inflammatory syndrome following COVID-19 to look for. Again, it is not particularly common. However, when we see cases climb so much, rare events do occur. And we've seen, and our healthcare partners have seen, multi-inflammatory syndrome in children here in Middlesex-London, as well as across the province.
Thank you very much, Dr. Summers. And we do have a last question from Jennifer Beeman, and it's one that references something that's happening on Monday that you've spoken about already, Dr. Summers. Jennifer asks, Dr. Summers, are you hoping people will really embrace Superhero Day at MLHU's clinics on Monday? Will staff be dressing up too?
Yeah, thanks, Jen. Yeah, we're really excited about Superhero Day. It's an opportunity to have some fun and remind ourselves what a cool thing it is that we've got this vaccine available to us. So yes, we are hoping people will embrace Superhero Day. We're hoping that for kids coming out, for parents coming out, feel free to dress up. For adults coming out, even if you don't have a kid, dress up, absolutely. And staff are certainly welcome to dress up as they are able. Of course, we'll still have our masks on. We'll still have our eye protection. We'll be following all good infection prevention and control strategies, but we are looking forward to celebrating Family Day and celebrating our littlest superheroes this coming Monday.
Thank you very much, Dr. Summers. And Dr. Summers, Deputy Mayor Morgan, that does bring us to the end of our questions for this afternoon's virtual media briefing. So with that, thank you for your information, your attendance, and your insights today. To our partners in the media, thank you so much for being part of this afternoon's briefing. And we hope you will join us again when we are back with our next virtual media briefing. And this is going to happen on Tuesday, the 22nd of February, because of course, as Dr. Summers just mentioned, Monday is Family Day. So we will be back on Tuesday, the 22nd at 2 p.m. We hope you'll join us then. So between now and then, have a great rest of your Thursday afternoon. Have a wonderful weekend and a very happy Family Day on Monday. So long for now.
TV viewer response line. Email us or connect with us on social media.
Hi everyone, my name is Dr. Mario Elia, and I'm the host of a new show here on Rogers TV that we're calling Keeping London Healthy with Dr. Mario. So tune in Wednesdays at 6:30 p.m. and we'll see you then.
Night's action on Rogers TV.
Bye.